Hi, my name is Dr. Virginia von Schaefer. I wanted to talk to you today a little bit about the diagnosis and treatment of early stage breast cancer. Now, of course, some people will find that they have a breast lump that they can feel that's new or different, and this is a point of concern. It could be benign, it could be malignant. How do people want to proceed? Or what's the best way to proceed? I have many patients who come to me and say, I know I have a breast mass, but I'm afraid of getting a breast biopsy. The fear is that the insertion of the needle and pulling it into the mass and then pulling it back out may cause transfer of cancer cells from the lump to the skin or other areas. Or in fact, the stimulation of putting the needle in the mass might cause inflammation and spread of cancer cells from another mechanism. So many people are afraid of breast biopsies. At the same time, breast tissue can be very cystic and hard, and in that case, it's kind of like trying to biopsy pavement or a piece of cement. It's hard to actually get tissue, and it's hard to get through the needle through the tissue, and it may require multiple passes before any tissue of value is obtained. And in which case, that can cause an increased amount of inflammation just by the mechanical trauma, and activate stem cells and circulating tumor cells, and yes, potentially cause the spread of breast cancer. So many women are fearful, but need to have an understanding of other ways to approach the situation. Of course, we have ultrasound, which can identify abnormal vessels going to a breast mass, and so that can be useful, but it's definitely not considered diagnostic. We also have a breast MRI, which doesn't involve radiation, although you do have to have a contrast dye, which some people don't want to have, but that can look at identify tissue density differences, and this can also help to identify whether or not there's any problem in not only the breast where there may be a mass, or maybe there isn't a mass, but also the opposite side as well. However, none of these techniques are diagnostic, and they certainly don't help in the treatment. Now, recently, I've had a number of patients who have come to me who were very adamant about not having a breast biopsy, and yet wanted treatment. And we evaluated the patients in terms of potential for systemic problem. In other words, is there a metastasis present beside the primary mass? And if the PET scan is negative and the patient has only one area of concern, it is possible to biopsy and treat in the same session. And this seems to help ease the minds of some patients, and it can be very effective. So in those cases, we utilize biopsy in the traditional manner and look for, obviously, receptor status and Ki-67 score, all these other parameters, and at the same time use brachytherapy to treat the mass in the same setting. So brachytherapy, again, is the insertion of these small radioisotope seeds about the size of a grain of rice that are covered in titanium and can be directly inserted into the tumor mass via imaging or CT scan. This is a great way to biopsy and treat at the same time. And we see that because the recurrence rate is pretty much nil at the site of treatment, this can be curative to patients. I have a number of patients who've been treated this way now in the past year, and the majority of them in their post-treatment imaging the assessment by the radiologist rather, is that they either had the tumor removed or it disappeared. So this is a very interesting option for certain people and can be explored and applied if it's an appropriate situation. Thank you.